I'm reading today for a lady who works for Edmonton Public Schools. A voice for our children. Thank you. I am one of many support staff employed by Edmonton Public Schools. I have been attending the rallies of the Angry Albertan for many months, and my experience has been phenomenal. I lost many friends because of a difference of opinion with this plandemic, but I have made many more friends here at these rallies. Since coming to the Ledge, I have noticed that there is never a teacher talking about their bad experiences with either masking or vaccine mandates. Then I realized why this is. Please let me explain. In January 2020, when in-person classes were suspended, teachers were given a bonus for teaching online. Keep in mind, teachers already make 6-digit incomes. Support staff did not get any bonus, and we definitely don't make 6-digit incomes. In March of the same year, teachers continued on with their online teaching, and educational assistants were laid off. That included me. When in-person education resumed in September, things had to be changed in the school. Support staff from my school spent the first day back before the students arrived setting up with sanitization stations outside and inside every classroom, putting stickers on the floor to indicate path of movement, and putting signs all over the walls about social distancing. Along with my classroom assignment, I was instructed to stand at the door daily and spray sanitizer on the hands of the students as they entered the school. I knew this chemical was caustic, so I was very careful about how much I would spray on their hands. It really bothered me having to do this because I wouldn't use the spray on my own hands. In fact, I never sanitized my hands with the school product. I always carried my own. Hand sanitizing was required every time a person either entered or left a room. I did have an age 5 student who loved the sanitizer. He would use a lot of it, and then he would sniff it. This little one had attention issues, which I believe were linked to the use of sanitizer. Often, I would point out to the principal that the sanitizer was stripping the wax from the floors. So what was this doing to the hands of our children? Nothing got done about it. One teacher made her own Lysol wipes by cutting paper towel in half and then soaking them in hand sanitizer. After students went home, custodians put on hazmat suits, including gas masks. They then fogged every classroom with caustic chemicals, spraying everything, including toys, pencils, everything. This spray takes up to 10 hours to dry. This was done every day. Is this really a safe environment for children to be learning in? I had to instruct the kindergarten children on how to use the masks, including that they were not allowed to talk without it on. The younger kids didn't understand it. The hardest part for me was making them run in the gym or seeing them participate in any form of exercise while wearing a mask. The older children were aware of what was going on, so they just followed along. What bothered them was not being allowed to socialize. They couldn't even go to the bathroom without permission. All this madness is still going on. The kids are suffering. They need their friends. They are depressed. I feel hopeless because I can't change any of this for them. I know that there are staff who are concerned about what they see happening in schools with continuous masking and sanitizing, social distancing, and now vaccines for children. They fear being identified at a rally, being reported and disciplined. There is enormous pressure from others in the profession to dissuade them from attending protests and speaking out. Staff are told if they attend an event like this, that they are exposing the entire school, including the students, to COVID, that they are stupid if they are not taking the vaccine, and that they are responsible for the spread of the virus. It has left anyone in the profession with questions or concerns feeling isolated, threatened, and like they have nowhere to turn for help. But why have so many teachers bought into this? How have classrooms become clinics? Why are our teachers giving medical advice to students? Why are vaccinations being given in schools? Here's what you should know. Teachers are being paid according to the number of students in their class. For every student they send to get the vaccine at the clinic, they get a bonus. The principal also gets a bonus for the number of students in the school who get vaccinated, and they get a bonus for having a vaccine clinic in their school. Let me repeat this. Teachers are paid according to the number of students in their class. For every student they send to get the vaccine at the clinic, they get a bonus. The principal also gets a bonus for the number of students in the school. They get a bonus for having a vaccine clinic in their school. Because of these bonuses, teachers have been bribed to comply. Doctors have also been bribed the same way. Remember in July this year, Kenny added a billing code for physicians who are in a community that has a low vaccine uptake for them to be able to go through their patient roster, review patient records, and if somebody hadn't been vaccinated, physicians could reach out to encourage them to be vaccinated. Teachers and healthcare professionals, silence and compliance has been bought. This is criminal. By the way, the vaccine clinics in schools are hidden away where nobody can see what's going on behind closed doors. My heart breaks every time I think of my sweet young students being coerced by people they trust. It's time for this to all come to an end. Every day, I pray this happens. I want to say to Josh, his wonderful wife Jen, to David and his wonderful wife Karen, that I really appreciate everything you do. You are the rock that keeps this group focused, so strong, and together. I am so grateful that you have worked tirelessly in a legal, peaceful way to end this crisis. Thank you from us all.